Welcome to the office. Welcome back, Barbara. All right, we're on visit number 4. How you doing?
Good. I mean,
overall, tell me what's up.
Overall, colon is, definitely working through its magic.
But that's not what you came for.
No,
What'd you
but
come
although
for?
that was actually a big part of it, I got to tell you, I just
Okay.
didn't yet. No, because I knew something was going on with my back that was affecting my colon.
And you see the connection between
Yes,
between
absolutely.
digestion and spine and digestion.
Yes, absolutely.
Okay.
So, my jaw is clicking again because I
Okay.
know it's kind of reverted back a little bit.
Okay.
My shoulder and neck right now are really bugging me.
Okay.
And this hip and this knee, like that, those were always the main issues.
So tell me, because it's been a little bit since I've seen you.
Yeah.
Right?
Every day is kind of different.
Okay. Is it the same as day 1 that we started?
No.
Is it feel like it's going slowly back though?
It's going slowly back.
This is an important thing we have to
Yes.
address as well.
And I also as far as my hands, knowing if they have arthritis, how do you know there's arthritis?
Okay. That's your question, right?
Yeah, and but it's mostly right now. It's this, like when I realize if I like go like this, if I'm turned sideways and I'm I can't. First of all, I can't bring this shoulder all the way back.
The right shoulder.
Yeah, I could feel it like.
She's trying to flex.
Yeah, I'm trying to flex. I can't bring my shoulder all the way back, and when I do, it just hurts right here.
Okay, we'll address that, and I'll explain it
Yeah.
on the X-ray. And on
Yeah.
Okay, and you were talking about the hands and arthritis.
Yeah.
How do we know, and what is it, right?
Yeah, like why
So
is that?
The idea with arthritis, and this is a big misconception. The word, first of all, is a misnomer. It's used incorrectly. Arthritis means I have inflammation of my joints. That only lasts 6 weeks.
Yeah.
After that, and I know I'm being a little bit funny about it, but the terminology is arthrosis. Number 2, it's not the arthritis that causes the pain. Listen carefully, this is important. So we get this calcium buildup in our body. It's the body's way of stabilizing some sort of instability, number 1. Now the difference between, let's say, arthritis or the term of what we call enuberation is 2 different things. I'm going to explain it. The thickening of the bone happens according to what we call Wolff's Law, Dr. Wolff. Bone will grow according to the demand placed on it. So let's say we're favoring and we're leaning on one side. That bone is going to naturally get thicker because bone is live tissue.
Yeah.
Does that make sense?
Yes.
So that's the body adapting. Same thing with calcium buildup. It's the body adapting. Now, you're boxing.
I didn't really box. I was just.
No, I'm
I
saying
was like,
with your work with this. So
Yes.
the question is, how about we take some hand X-rays?
Okay.
Okay.
Yeah.
And I'll do them, and just let's see. And you can, because a lot of times people have other joint issues, and they're thinking it's arthritic cause. Well, that, number 1, is the wrong thing to do.
Really?
Yes, I'm glad you just did that. Okay.
You
go.
don't really. I always
Okay.
was told that
Pull.
cracking. Oh,
Pull.
pull.
Okay,
Okay.
this is
and I've
important.
been pulling actually.
Pulling is fine. This will cause arthritis later in life, which causes stiffness.
Ah.
The stiffness isn't the pain, it's stiff. It's I can't open and close my hands. The pain is something else. And this is what, now let's go to the next step. So I have this lady in, she's about early 60s. She lost about 6-7 pounds of inflammation. Okay, on average people losing 10, 15, one guy lost 25. Great. But here was the cool thing. She goes, Doc, listen, I'm happy with where I'm at. I do like the fact that I lost some inflammation, but most important, I've had arthritic pain in her mind, in my hands for years. It's gone. And this was the key. It was the toxicity, the inflammation from the food, from the digestion that was causing her joint pain. Does that make sense?
Yeah, but yes, and
I'm giving you one piece.
Yes.
So as your digestion is getting better, number 1, joint pain should get better.
And it has.
Okay.
It definitely has.
Number 2, the nerve supply is what we're working on here. So the nerve coming from here is what controls the arm. So one is the neurological control. Number 2 is the mechanics, kinetic chain. Number 3 is the fuel that we put in our body.
Sure.
So the idea right now is we're working on this. We're going to start working more intensely on this. You're working on the digestion. We'll take an x-ray and see if there's any calcium buildup. But it's not that doesn't usually cause the pain, that causes the stiffness. And when you crack or pop your knuckles, distraction is okay. So doing this, you can do all day long. If it doesn't do it this way, don't do it.
Got it.
Okay?
Okay.
If you do this over the years, which a lot of us used to do,
Yeah.
this will stretch the ligaments over time. And if those ligaments get stretched, there's instability, which causes the calcium buildup because there's instability. Does that make sense?
Yes.
Okay. Now, if we're punching, let's say, forget the arthritis for a second, we're punching, boom, 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 the bones get thicker. That's not arthritis. That's because you're putting a lot of demand on it. Does that make sense?
Yes.
That's the difference. Someone's getting beat up in the face all the time. Their bones get
Yeah.
stronger.
Yeah.
So do the boxers.
I don't do that anymore.
Okay, good.
Okay.
All right, so we're clear on that?
Yes.
All right, so let's figure out where we're at. Anything else? Anything else before we start?
No, just the same, like just the knee, and it varies. Like when I'm laying in bed, like I had a hard time sleeping last night. Just it moves. Like sometimes it hurts over here, sometimes it's over. It switches,
Shifting.
and I'm like, dang, I can't go to bed until I like do this a little bit and crack it to like.
Okay.
And yeah.
And what is that? So when something switches sides in the body, same thing, opposite side, elbow, wrist, hip, knee, foot. It's hurting here today, it switches there. It's hurting here today, it switches there. The way I was trained, spine first. And
Yeah.
that's what we're working on.
Yeah.
Now, last thing I want to comment on, please, is you said it starts to go back, and yes, it does. Where's my vertebrae model? This is the idea, okay? I'm going to use this as an example. Let's say we're here. I'm just giving an example.
Okay.
We're here, but we want to be here. We're here. We've been like this for years, so these ligaments have shortened over time. That's that tightness.
Yeah.
We give the adjustment, it goes forward, it's where it needs to be. It slowly wants to creep back. We adjust it. Each time it stays longer. That's in the beginning. Does that make sense?
Yes.
So it's not, I'm going to adjust someone who's had something chronic or for years, a couple of times, they're going to be out of pain. You felt good.
Yeah.
But are we trying to just feel good, or are we trying to correct the cause?
Yes.
That's the problem. Number one is, so we're doing a series of adjustments to keep it there. You're doing your part by the movement, the activities, the posture, the nutrition.
Yes.
Not pro-inflammatory food. So it's multifactorial. It's not one thing.
Yes.
Make sense?
Yes.
Okay. I just wanted to explain that as to what's going on.
Okay, got it.
Because we had a little extra gap.
Yeah.
For whatever reason, it's fine. Starting at the base, 15 points, left side. Switches there, keeps going. That's more muscle tension. We're at the base today. I'm going to explain your shoulder again on the x-ray as soon as I finish this, okay?
Okay.
And what needs to happen for it. Do. T7, T8. Right side. So the sacrum is not holding there in terms of what we did. When did you start to feel that? You were doing good for how many days before you started to feel the shift?
I want to say about 4 days ago.
Okay, so about 6 days you were
Yes.
okay. 5-6 days.
Yes.
Got it. So 5 days you were good. The 6th day you started to
Yeah.
feel it. Okay, come back slowly. Back in extension. 1, 2. S3.
Yeah.
S4. S3. S4 more tender. I'm feeling it.
That is.
S3. Head down, please. Round your back. Round your back. Round. Do. Right there. 1, 2, 3, 4, 5, 6. That's 7. That's 8. 7 more tender. 8 more tender.
7.
Not 9.
No.
Starts a little at 8, but
Yeah.
definitely 7.
Yes.
7, S3. I want you to bring your left hand behind your back, please. All the way behind.
Wait, left hand.
Yep, all the way up. Thumb up your spine. Hold it there. 1, 2, 3, 4, 5.5. Bring it back around. Do the right side. Bring it behind. Okay, 1, 2, 3, 4, 5, 6, 7.5. So this is more limited. Okay, we want to even that out for you. Okay. 7, S3, let's check up top. Now, if you remember me talking about the neck, we need to talk about you working on getting your neck curve back. Your discs are still decent there. Okay, and number 1 is no pillow.
Oh, no pillow.
No, you have a reverse curve, so putting a pillow is going to keep it reversed. So right now I want you to do no pillow. You can use a towel, fold it in 3, and start to lay on it this way to start to develop this.
Got it.
Okay, I'm giving you some easy solutions. There are people who do traction in that. I don't personally do it. I think you can do it if you change the habits. You feel this?
Mm-hmm.
Okay. I'm getting it here.
Mm-hmm.
Right there. So I'm going to be straightforward with you, Barbara. As long as the curve is reversed, those are the nerves that control the shoulders. That's the posture.
Totally.
So we need to work on bringing it back. And again, you're more active than most people.
Mm-hmm.
Okay, so that should be more of a priority for you. Developing that neck curve.
Yeah, so
your
no
low back
pillow.
curve is fine. So yeah, your low back curve is fine. It's the neck curve.
Yes.
And the neck curve, this is the one that controls the shoulder, okay?
Yeah.
Now, I want to go over the x-ray again real briefly.
And like to move it this way is harder.
So, your curve here is decent. Your discs are fantastic here, Barbara. Great. You get over here, that's that reverse curve. So you put a pillow here, you're just accentuating it, you're not fixing it. Does that make sense?
Yes.
So I would start with no pillow for now. Let's go from reverse to straight and then develop
And
it.
just sleep on the back.
Correct. 2 pillows under the knees, no pillow under the neck. Now, let's look over here. So, we're looking at the scapula here. It's winged out this way. It's this curve that's starting here that's causing, it's tilting, the spine is tilting like this, so this wing bone is going out and then the shoulder is up. I'm going to set it, I'm going to keep setting it. But if we don't correct this, whatever this kink is, that's your normal. That's fine. I'm not worried about that. That's the main thing I'm worried about. Okay? So our focus, your focus, neck curve.
Got it.
You can do all your research you want. You can look up all the stuff you want. You want to focus on developing your neck curve. Okay?
Yes.
Because those nerves control the sits muscles. Can I start?
Yep. Oh my god, that was so freaking great.
That's the home run, baby. Okay. Let's do a tiny bit more. It was a little crunchy. Let's get a little more on that right side. And that's the home. Gotcha. Let's walk it off once, please. Good times. Feel that shoulder. Why don't you flex that muscle again in that shoulder? Tell me if it changed already.
Yeah, a little bit. Yeah.
A little bit, right?
Yeah.
I'm showing you the connection.
Yes.
Now, watch. Try this. This is going to be... So, do that again.
That's when yeah.
Okay. Now, watch this. Let's put a little curve in your neck. Relax. Relax. Put a little curve. Do it again. Now, turn.
Yeah.
If you keep that curve,
Yeah.
you should be able to do more. Try it. Do it again.
Okay. Right there.
Okay.
How am I doing? Do I move my neck?
Yeah, just bring it up a little bit. Now try to move more.
Wow. Yeah.
A little tender.
Yeah.
Come over here. Let's continue.
Which
I'm just showing. I'm showing you the connection.
Yes.
That's all.
No. I totally get it.
Okay. I'm not expecting to fix it all right now, but I'm trying to show you the connection. Let's do that. Let's do that sacrum. Let's go face down over here. And what I'm looking at is I want to see all this swelling gone. This is inflammation, okay, Barbara? I see that gone, I know you're doing well. Slide up. Okay, nice and easy. Palms up, receive. We're gonna do a P4-R, and we wanna torque slightly up. That's a bit. 2, 4, 5, 6, 7. That's the home run. We'll do that on the side. And before I finish the sacrum, I'll have you walk it off once. You'll do the twist again with the biceps and see if it's different. Hands up.
Yeah.
Try it again.
Oh, yeah, wow.
Where is that coming from? That part is there.
Yeah. Wow, yeah, even like being able to like, because I was like right here. Now it's like
Now you got a little more.
trip. Okay.
Okay? Mechanics. Left side down. Rotated sacrum. Now I'm going to roll her towards me. I don't want to hunch over too much. You do that all day long. Doctor's going to hurt his back. Look straight ahead. Let it roll. Let it roll. Gotcha. Nice. Stay on your back, please. On your back.
Stand on my.
Let's do your ankles. Good times.
Right on.
Good times. AS talus, medial tilt. Raise this up. There you go. Sit up and turn, please. And let's walk it off a couple of times. Good stuff. You can tell me how the hands feel also and how the knee feels.
Yeah,
Should feel different.
totally.
Good.
Totally. Yeah, trip.
Have a seat. Let's continue on the shoulder now. We still have to set it over, around, down. Relax there. There you go. Over, around, relax it. There you go. Ears. Let's rescope. Make sure everything is clear. Scoot forward a little bit, please. Nice. So you're clear on your homework, right? It's all about that neck curve.
Yeah.
Neck is clear now. Mid back is clear. Low back is clear. Jaw's good.
It clicks, but right now it's not clicking.
Sit back for me and I just want to see. Look up, slowly open and close. Slowly open. Slowly close. Uno más. Right there. Open slow. Just a light set. Open. Okay, open fast now. Open. 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 Slowly close. There you go. There you go. Sit up straight, please. Now you get the buttons and polish.
Yes.
Different perspective. Austin. 5, 4, 3, 2, 1. 5, 4, 3, 2. All right, Barbara, we're all set. Squeeze. Lunate. Scaphoid. There. See how that's doing that still? Look, it's not fixing. I have a seat there, I need to do more of the neck. So if things aren't holding in that wrist whenever I'm shaking the hand, that means there's more stuff going on in the neck, so I need to get a little bit more of that. Sit back for me. I know we got it, but let's get a tiny bit more. Okay. And I'm just going to change the angle. Look down and up. That's not it. Center on the chair. Center.
Center.
There you go, all the way back. Left ear down, 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 down. That's it. Stand up. She's like, what the hell did he do? Squeeze. Squeeze. Stand up. Squeeze. And turn it on the elbow. There you go. Squeeze now. Rubber band exercises, I want you to start doing extension with the rubber band.
Mm-hmm.
Fingers are straight, just doing this. Okay?
Okay.
Extension. Hand is in flexion, in extension. So 10 to 15 degrees of extension, doing this.
Okay.
Okay?
Mm-hmm.
You're not this. Do it now.
Oh.
You're on the mouse a lot, or
Yeah.
trackpad. That's your homework.
Okay.
I'll see you in 6 days.
Awesome. Thank you. That was great.